Today, my guest is Dr. Dua Makkar, and she is an award-winning dentist practicing in Long Island. Her focus is on oral cancer awareness after the loss of her brother, Dr. Mano Dua. And she is amazing spreading awareness, and this is something that we really need to know about. October is National Dental Hygiene Month. So this is a really good time to learn about this topic. So thank you for the work that you do and for being on the podcast and sharing more with us about oral cancer, which is one of the growing cancers worldwide, correct?
Correct. Thank you so much for having me, especially on Dental Hygiene Month. It was a pleasure meeting you in person. Um, but yes, oral cancer it's one of the six most common cancers diagnosed right now worldwide.
I when I heard that, I was like, oh my goodness, because we're taught to look for that, but some offices do and some offices don't. So that's why I think that this is really an important topic to talk about because especially when I graduated hygiene school, it was only common among people who smoke or drink, and now we're seeing it more in the younger population.
Absolutely. The demographics have changed. Still, men are more susceptible and the older age, but right now, I would say 20% of the cases that are diagnosed are under the age of 55. I mean, my brother passed away. He was a dentist. He was 34 at time of passing, 32 at the, no, actually, he had just turned 33 at the time of diagnosis. So it is definitely in the younger, especially with vaping, with the high incidence of HPV. Um, and so it's on the rise.
And most of these cancers, the survival rate is under 5 years because of when you find it, correct?
Correct. It's an aggressive cancer, the head and neck area. The chances of metastasizing are much higher. We have a huge node system, and that's how cancer spread through the lymphatic or the through heme. So the key to all of this survival rate is the earlier diagnosis because the cases that are getting diagnosed, at the 70% of the cases that are diagnosed are stage 3 and 4, and their survival rate is actually, 50%, but the higher survival rates are the 1 and 2 before they actually metastasize, before they spread.
And so, what are you recommending to be able to find it early?
Definitely know the risk factors, right? As a patient and even as a dentist and a hygienist, know what your patient's risk factors are, asking them the questions. When they come in, do a head and neck screening, and it doesn't take long. It takes a couple of minutes while the patient's getting numb. Hey, have you noticed anything different? Are you having trouble swallowing? Because the oropharyngeal cancers are harder to diagnose. They're in the back of your mouth. So usually hoarseness, or if you feel a lump, a node that's inflamed, when you're doing a palpation, and especially something that's unilateral. If they're having trouble moving their tongue, then, just ask your patients normal questions. Anything's changed? What do you see? Yeah, I bit my tongue. Oh, let me see. What are you looking at? Or I see something. I don't know what that is. Just kind of ask those questions and take a look, see. Really, visual is our best bet, visual and tactile. And we're really, really good at that as dental professionals. And if you see something suspicious, learn how to do a biopsy yourself or get the biopsy as soon as possible. The whole idea is not to delay the diagnosis of of the cancer.
And what about patients? Because there's 50% of patients that don't even go to the dentist. So, what about people that don't go to the dentist? What can they do to look in their own mouth? What can they look for?
Yeah. So patients who don't go, obviously, if you see something, or something is hurting, not necessarily does cancer hurt. When it gets to that stage of hurting, then it's gone, it's deeper. And so, of course, if something hurts, go in and get it tested. But just like we are all programmed to do a self breast screening, right? We're taught. I think there needs to be a more awareness of like you're brushing your teeth, you're looking in your mouth, you're sitting in the car, you can pull down the visor and you can pull the mirror up and just be like, yeah, what does that look like? Maybe I should get it checked out. Just doing a self screening on your own. When you stick your tongue out and it's deviating, it hurts. I can't move it to the other side. Something's off. But just being mindful, just like you would see a mole that has changed colors or has grown in size and you want to get it, We're not necessarily always screening for skin cancer, right? You're not going to the dermatologist all the time. So I get that. But just having that mindfulness of paying attention to your body, knowing you know your body, you've grown up with your body, you know when something's off, go and get it treated, go and get it checked out.
Yeah, I agree. And you bring up a couple of good points. No pain does not mean no problem. And a lot of people believe that. And I think that we spend more time taking care of our car and our houses and our kids than we do ourselves and listening to our body. So that's one of the things that I talk about is being the owner of your health and really looking at yourself, and that self-care isn't selfish, but most of us don't even look at our mouth. We get up, we brush our teeth, we're half asleep, and we're not even looking at the sides of our tongue or sticking on our tongue, or some of us not even brushing our tongue. I think the statistics are most people brush once a day for less than a minute. So we do need to make sure that we're doing a self-check on just checking in with ourselves and looking in our mouth, sticking out our tongue, looking at the sides. So those are very good points that you bring up.
Yeah, no. Yeah, it's self-awareness, self-advocacy, you if you don't take care of yourself, how are you going to take care of others? How are you going to take care of your house, your car, everything else? So your body does tell you things. You just have to pay attention to it. And when there's something is wrong and you feel it, go and get it checked out.
That's why I think what you're doing is amazing and really important because we have to bring more awareness to just how important your mouth is to the rest of your body.
Thank you. Yes, the oral health is the gateway. And, oral health is now being linked to so many things, right? To diabetes, to stroke, to dementia, Alzheimer's. The list is on and on. Even with low baby weights, at term baby weights. So it's even linked to poor fertility. So there's a host of reasons, right? Like even when you're pregnant, some people think like, I should go to the dentist when I'm pregnant. Well, there is pregnancy gingivitis. You have hormonal changes. You need to make sure your gum health is good. All that bacteria is traveling through your body into your fetus, right? So it's linked to everything. And you're right. It shouldn't hurt to become a problem. Just like when I'm looking at x-rays, then patients are like, I don't want to take x-rays. Do we just take them? I'm like, well, you're getting, they're worried about radiation. I'm like, you're probably getting more radiation from your phone, your microwave, you get on a flight. Um, but it helps me look at a cavity, and a cavity doesn't hurt until it gets into the nerve. And then you're looking at a root canal or fracture or maybe even an extraction. So let's address the problem before it becomes the problem, preventative care. I think there's a disconnect, and this is why I created the Oral Cancer Symposium, that before patients go in for any kind of surgery, whether it is a routine surgery or it is a cancer surgery, not necessarily oral cancer, it could be any other form of cancer, have them get a dental checkup. Like they need to make sure they don't have any active disease going on in their mouths, because post surgery, you may not be able to go to the dentist when something does become a problem, a loose teeth, an active infection, periodontal disease, you need a cleaning. After you get maybe a heart surgery, maybe knee replacement, anything, there is this fragment of time you cannot see a dentist.
Mhm,
And then when you're in pain, you're in trouble
mhm.
because now it becomes a problem. And so there's that disconnect that, yes, we need a dental clearance before you go in. And especially with cancer, do you get, radiation trays? You need fluoride trays. There's mucositis. There's a whole host of things that happen. And there's such a lack of knowledge and the need for this connection between oral health and overall health.
Yes, I agree. As you know, when it becomes personal, that's when it becomes a mission for us.
Yeah. And with losing Manu, there's always a guilt attached to it. He was my younger brother, so I felt like I had failed him as an older sister, as a dentist, and and I couldn't save him, and there is nothing I can do to bring him back. But my hope is that with this awareness, with educating patients, educating other, not only medical, dental, but medical professionals also, that key importance that we would be able to save lives, with that early detection, knowing your risk factors. Um, and signs and symptoms.
And so something good came out of a tragedy, being able to help others because of what you went through. So, I mean, when you go through things like this, you can go one direction or another, and you chose the positive direction and making a difference because of what you went through. So, I think that that's wonderful, and kudos to you for, seeing that need and finding a way to fill it.
Thank you. Yeah. Yeah, if Manu missed it, who was the dentist, knew the risk factors, was under the care. And another thing I'd like to highlight is, for patients and for doctors, don't treat a disease without knowing what you're treating. And I speak from experience because Manu was given prednisone without having a biopsy. It
Mm.
was lichen planus, which did not look like lichen planus. And when the biopsy came, it was a little too late, but he was given prednisone, which is an immunosuppressant and which made the cancer more aggressive, in my opinion. And so the key point to all of this is like, get your patients to do the biopsy so you can diagnose it early, and don't treat without knowing what you're treating, you know? And if things don't resolve within a week or so, let's reevaluate the situation. He was on a prednisone for a month before the biopsy was even done.
And for our listeners that don't know what lichen planus is, can you explain what that is?
Sure, that's an autoimmune disease, and some people who suffer from it, it's very painful, and it's usually bilateral on both sides of the mouth, usually brought on by either some stress factor or a gut health, different factors. It's an suppressant uh, autoimmune disease. So, and with Manu, what I want to highlight is his cancer was one-sided, so it wouldn't be something like a lichen planus. It was only on one side of his mouth, and it was extremely painful, which lichen planus is, but it doesn't. It presents very differently than oral cancer does. Yeah.
And how big was his oral cancer? I mean, was it small, like a couple millimeters? What was it when they finally noticed it?
The initial lesion was it was small. It was on the lateral border of his tongue. So not something, oral cancer are divided into two categories: oral cavity, which is anything in the front of your mouth, the anterior 2/3 of the tongue and everything, the hard palate and beyond, and towards the lips. And then the oropharyngeal cancers, your posterior cancers, and those are the HPV related. So his was on the lateral border of his tongue, risk factor that he was a male. And yeah, it was just like, it almost looked like he had chewed out his tongue. But it was present for many months. And I would say it was about 4 by 6 millimeters. Um, and that lesion he showed me was in June. He lived in Canada and in the US, so I wasn't there for the entire process. And I'm like, get the biopsy. And I flew in to see my parents. I do every year in July. And when I saw the tongue, half his tongue was brown, leathery,
Oh, wow.
like very classic. And I gave him a look like, kidding me right now? He's like, "Yeah, I'm getting and he had those classic symptoms, unilateral earache, unilateral jaw pain, inability to, like, we went out for sushi. He's like, no, I can't have wasabi. It hurts my tongue.
Mm.
Um, so pain, discomfort, trouble swallowing, all of the classic because the cancer had progressed. And when he was diagnosed, it was stage 2 with neck node involvement. So he did have a neck dissection, a hemiglossectomy, radiograph from his arm. And he was a solo practitioner. And he returned to work. Like August, he had his surgery in 2019. October, he was working with patients.
Wow.
But, yeah.
That that is a lot. And yeah, and so that just shows you that we don't look in our mouth, and we kind of just ignore a lot of the symptoms. And that's, I think that's more common than not.
Right. And mats are great. I mean, anything the things that we put in our mouth, pens and paper clips, all sorts of things. We open packages you're not supposed to. Don't open beer bottles with them. Um, but anything, the mat's a beautiful place. Anything heals beautifully within 2 weeks. And so we kind of ignore it because we think that it's so resilient. But it isn't. And anything that's hanging out for more than 2 weeks, get it checked out. It could be not necessarily as a cancer. It could be a hepatic lesion. It could be shingles. It could be so many other things. But or the 2-week warranties a checkup.
Yeah, and I think there's over 200 diseases that have manifestations that start in your mouth first.
Mhm.
So,
Exactly.
so yeah, definitely not ignoring something that doesn't go away. And that's a good point too. Usually things in the mouth heal after 2 weeks. So if it hasn't healed in 2 weeks, it could be a problem.
Yeah. Another thing, I don't know how much the public is aware or people aware is when you are in your dentist chair and you go over medical history, health history, we all know airway is connected. If patients have a host of um, medications, their high blood pressure and cholesterol or whatever, airway is one of the things we want to look at, especially classic symptoms. But also with cancer, if they have a past history of cancer, certain cancers can metastasize to the jaw. And so knowing that a patient has a history of cancer, it may not present because metastasis happens. So if you've diagnosed with lung cancer, with breast cancer, especially breast cancer, it's high in Long Island, very high, I think one of the highest in the nations.
Mhm.
Um, and these, you may not have any other breast symptoms, but you could have a metastasis to the jaw, to the face, somewhere intraorally. So be mindful of that. And that's why going to the dentist is so important.
Yes, absolutely. So you have a website. Tell us more about how people can get in touch with you and just where they can get more information from you if they would like.
Yeah. So I do have the DUA goodjob.com, which is an overview of oral cancer. Because when I was on the sidelines watching my brother, there were so many questions I had. And who do I talk to? What specialist? And oral cancer, any cancer, I would say, is not a unilateral thing. So what I created was something that gave oral cancer an overall view. How do you properly screen your patients? Of course, know what it is, risk factors, but then what are the oral systemic links? What happens from a specialist point of view, and what are the emotional aspects? Maybe it's your loved one that gets diagnosed with cancer, maybe it's your patient, or how do you help the caretaker who's coming in? How do you help take care of um, post, like radiation, with you get mucositis, you have taste changes. Maybe they've had parts of their face missing, besides their teeth, and they have limited opening, and they can't clean their teeth. So, like, there's so much more to cancer than just getting a biopsy and a diagnosis. It's the emotional estate planning, it's nutrition, how do you properly hearing cancer stories, and that's what the Dua Good Job Symposium is all about. With CEs for dental professionals, but it's open to all healthcare professionals. It's bridging that gap. And then hopefully leaving with an inspired message that cancer does not have to be. And, you are a prime example of that. It doesn't have to be,
A
it
death
can be
sentence.
superpower.
Yes, it
you
doesn't have
know,
to be a death sentence.
exactly. You can be, let cancer not define you. Um, and people get a little bit of swag. You get the copy of the book that Manu wrote while he was dying. And so, yeah, so DUA, good job. That's how I'm on Instagram. You can connect with me. And I also help provide coaching, grief coaching for healthcare professionals, because it's so hard to be present when you have somebody, and I'm sure you've traveled this path, when you have somebody you love who's fighting their lives and you lose them, and you still have to show up to work and be present while you are emotionally distraught. And how do you find that balance to take care of yourself first before you can, as healthcare professionals, I think we're giving up our time, our energy, our pee breaks, we skip over lunches. It's so common. And then if we're emotionally empty, how do you show up? And that's what my grief coaching is on for healthcare professionals. So all of that's on the Do a Good Job. And when people go, they can even get ebooks, free ebooks to download too, that can kind of help guide.
I did not know that, and that is a wonderful thing that you offer.
Yeah.
That definitely, yeah, that hit home. So I did not know that you offered that as well, and I think that that is just a phenomenal thing that you do, because you're right. How do you show up when you're going through something like that? It is hard, and you have to be there for people because that's what you do. And it is emotional when you hear the cancer word. Sometimes your brain just goes dead. And I went through cancer during COVID.
Mm.
So it was not a personal experience and they wouldn't let people back in. It was all about protocol. It wasn't about a person at all. And
Yeah.
so it was a totally different experience. I had a girlfriend that had breast cancer 6 months before I did, and her experience was completely different than mine because mine was at the height of COVID.
Yeah. And
So
so
I
was
was
Manu.
a number. I didn't even have a name.
Yeah. And with Manu's was during COVID, when his cancer came back, literally like cancer, we got shut in March. His cancer was diagnosed in April 2020. So
Wow.
a lot of his chemo, radiation, immunotherapy, my parents would drop him, pick him up. And one of the hardest conversations, and I'm very open about this because I feel, A, it helped me go through the grieving process. I'm sorry, I could give you a big hug
It's
right now.
okay.
But I've traveled those shoes, and I'm not a cancer survivor, but cancer still is, and I say I bear the unseen scars of cancer. I don't have it, but I know, and it still takes a seat at my table. It's still a part of my life, even though Manu isn't. Um, and it's like, cancer, you see all the scars and they hurt and they may look disfigured, but you wear those warriors
Mhm,
signs. But with unseen scars, it's like a deep ache. And sometimes it's like you forget all about it. And but then you move in a certain way, you're like, oh, and you feel that deep pain inside. You're like, it's still there. It's still there and it's still vivid and still hurts. So I bear those scars. But with Manu, a lot of the treatment was alone. So my parents, who are very elderly, and when Manu was first diagnosed, my dad asked me, we lost my grandmother to pancreatic cancer, so my dad's mom. And so he was acutely aware of having to take care of a loved one who has cancer. Um, and that was, 30 years ago in a different part of the world. And this is his young son. And when Manu was first diagnosed, he called me up and he said, is Manu going to die? Because his mother died of pancreatic cancer and cancer equivalated death. And I said, no, no, Papa. They're just going to take out that lesion from his tongue. He's young. He's healthy. He doesn't have diabetes. He's not a smoker. He doesn't have any comorbidities. He's
mhm,
a young, healthy 30-year-old. He'll be fine. Don't even worry about it. They're just going to do the surgery. It's going to be all good. And a cancer returned. And in February of 21, at this point, Manu's got a chessboard. We knew things were bad. I knew in Jan, I had seen his reports. And I was told, um, I kind of, Manu, because he was in isolation for a lot of the times, he did not share because he was scared to mention a lot of the things to worry parents more, me more. But I had some insight and I got a report and they basically said, you need to make end of life decisions in January of 21. February, he was going back for more immunotherapy because cancer was spreading and he needed more treatment. And my dad asked me that same question. Is Manu going to die? I was at work and I said, yes, you have to be prepared and I cannot give you a time frame, but he is. And you have to do whatever he asks. Um, and these are the things that nobody guides you. These are things I hope nobody ever has to share and be telling a loved one. And with COVID, I missed him because of PCR testing, border shut down, and all of that. So I didn't get to see him. I saw him in December, 3 months before his death, but I didn't get to see him. I was trying to make it to Borders, and he and I talked like this, like you and I are talking. He was on a morphine drip, shutting down. And I was like trying to expedite this PCR testing. And I had to tell him, you go, don't wait for me, giving him that permission to let go.
Mhm.
Um, because I'm like, you're done hurting. You're done. Just go if you have to. I'll make it. I will be there.
Mhm.
But don't wait for me. I'll find you. One of these days I'll find you. But for now, you need to go.
And that is important when you are dealing with a loved one who is getting ready. They do feel like they need the permission because they are worried about you as well.
Of course. And that's Manu always protected. He was almost 10 years, 8 years younger than me, almost a decade. I watched him come into the world, into the field of dentistry, and I watched him leave, and dentistry made him leave. Um, but yeah, they do. They need a permission. Um, the body was failing, and the mind was just like, mind's a very powerful thing.
Mhm.
And that's what he wrote about in his book about hope, immortality, fighting, your mistakes and being better, not making your mistakes define you, learning from your failures. And that's what he writes about in his book. And he taught me a lot of things. And I think somewhere is the roles reversed. And, but yeah, these are things we don't openly talk about, especially in our profession. We always want to put up this brave front, whether it's depression, anxiety, dentistry's had a high suicide rate. There are a lot of challenges, and it just helps sharing the burden sometimes to know that, especially somebody who's been there, done that, like, I know what that feels like.
Yeah.
Yeah.
Yeah. Well, thank you so much for sharing. And if you could give someone that's listening one piece of advice, what would it be?
Pay attention to your body. It tells you signs. And remember that the mind, body, and soul have a remarkable capacity to heal. You are stronger than you think.
That's beautiful. Thank you so much for being here and sharing. And I'm going to definitely get his book. I want to read that. And I really do appreciate you and everything that you do and sharing your mission and passion with us.
Thank you. I appreciate that. Thank you for having me and for doing all the good that you do. I
Thank
appreciate
you.
it.